And finally, we asked attendees what are the biggest themes emerging at this year's conference.
Society moving towards EHR systems, it will be really important to focus on the data analysis part. And what is in the data? You have big data. How can you make sense out of it? That's the big theme, I think.
I think that the distributed systems are a good theme that's coming up. Consumer health informatics is really growing. There's a continuing growing presence in public health informatics that's very exciting. We're talking today from one of the tutorials preceding the conference on public health informatics.
Interoperability of electronic health records is a big concern. Of being able to connect different health systems and get the information is one of the things that we noticed. And another thing for me is just quality improvement and how the electronic health records will really improve patient outcomes.
For me, the biggest topic was the NLP, because my PhD thesis is about the NLP and processing free text in the medical information area.
And I think if we talk to all of my colleagues, our disappointment with the current electronic medical record and the usability aspects of that, probably pretty universal. It's probably the worst part of our day, actually, interacting with those devices. And I think there was some good discussion at the last topic about that.
As patient data is getting more portable, I think we're now coming to the point where we have to figure out how to visualize it and how to make it useful for the patients themselves, as well as easier ways for a clinician to look through it and find things more quickly and easily.
How medical informatics and biomedical informatics is such a multidisciplinary field, and also just the concern for how to talk about the field and how to talk about how we need to develop programs educating young biomedical informaticians and how to really advance the agenda of AMIA in a way that really accounts for all the diversity within the field.